Well, half of the states have expanded it, and about half of the states have refused, such as my state of Florida. The Republican governor and the Republican legislature, not wanting to have anything to do with what they were condemning as Obamacare, refused to expand Medicaid in Florida, and that was refusing to give health care to a population, if you can believe this, of 1.2 million people in Florida that would have had health care but do not get it because the state legislature and the governor refused to raise the level. By the way, that was taking Floridians' federal taxpayer dollars of $51 billion over the next several years that was allocated to that, and refusing to accept that for the health care of poor Floridians over 1 million people. I mean, that seems unconscionable. This stuff is so complicated, people don't realize, in large part, that is in fact what happened over the course of the last 2 legislative sessions, that they could have expanded health care in Florida. And it's Floridians' tax dollars that they are just giving away instead of letting that apply to health care for Floridians. But I want the people of Florida to know that 2 years ago in their state legislature, they took away the legal power of the insurance commissioner of Florida to approve the rate hikes. They took that away. Now, I happen to understand something about this. Before I came to the Senate, I was the elected insurance commissioner of Florida. And I jealously guarded that ability to approve rate increases and decreases in order to protect the insurance consumer. The legislature of Florida stripped that ability of the insurance commissioner, now appointed, not elected, in Florida. And therefore, if they see rate hikes for Medicare Advantage in this next round just about to be announced, they took away the ability of the state regulator to limit the rate hikes. That sounds unconscionable? It certainly does. Every year, insurance companies are going to try to raise their rates. It's the job of a state regulator to regulate what happens to those rates. And so the Florida legislature last year passed Senate Bill 1842, and one of the things it did, it stripped the Office of Insurance Regulation of one of its chief responsibilities, regulating health insurance rates. And that's after Florida had had some of the strongest laws governing insurance. And that was the case when I was insurance commissioner 15 years ago, of which I could not only approve rates, but I could reject rate increases. Well, we saw this at the time a year ago. I contacted the governor and urged him to veto the bill. But sadly, it is the law of Florida. And therefore, that's why I come to the floor today, because I'm disappointed in the news reports that are starting to say that these rate increases in Florida are being blamed on the Affordable Care Act. They're being blamed on Obamacare. Well, the insurance commissioner used to have an opportunity to look at those rates and say that they were not right and to stop those rate increases, or to give a rate increase that was actuarially sound. Not anymore. There were a lot of other things that have been done in our state of Florida to stop the implementation of the Affordable Care Act.